Hi, everyone, and welcome back to your favorite podcast on everything hormone, Hormone Hackers with your host, Dr. Annette. So, if you've been with me for the last couple of episodes, you know we are talking like a brief overview of the adrenals. So, we're calling this the Adrenal Apocalypse. And this is the third session. And in this session, we're going to talk about inflammation because it's like a continuous stimulus to the adrenals if there is that kind of stress or that kind of inflammation everywhere in the body. And I think what's important about that is that a lot of times we're not even always aware of the inflammation, in that we think, oh, well, I can't feel it, or I don't know about it, or I didn't have a recent injury. And kind of speaking as from a chiropractic point of view, I have to say that there's a lot of times when, through palpation, you might be palpating someone's muscles, soft tissue, what have you, and they're like, ow, they're kind of like do this, and they're like, oh, I didn't know that hurt. Well, the inflammation didn't happen as a result of the palpation. In fact, the inflammation was already there. It was just on a lower level that they weren't aware of it. That doesn't mean that the rest of your body is not aware of it. And kind of basically what we're talking about when we think of inflammation, just kind of as an overview, it's basically when tissues are damaged by trauma or by infection, in particular bacteria, or almost any other way that they can become inflamed. And I think we get a little jaded, or we just pop some Tylenol or something like that and kind of move on. But the fact of the matter is that this chronic inflammation can actually be more damaging than the trauma of the disease, or whatever caused the inflammation in the first place. Great examples in a lot of our autoimmune cases, what we're dealing with is this chronic inflammation. And I think you could say that pretty much across the board. One really good example could certainly be, rheumatoid arthritis. We can think of that, the inflammation attacking the joints, or osteoarthritis. But the fact of the matter is that chronic inflammation left unresolved, if you will, can actually end up being quite damaging. Now, ideally, in a strong stress response, we would be able to produce enough cortisol to kind of alter a lot of the physiology, a lot of the things that happen in a chemical way. On a cellular level, there's a lot of different things that are going on, but if we have this, like, big production of cortisol, that would really help us. And I think of that a lot of times when we think of a more acute trauma, where that would be coming into effect. This is also why you'll see, many times in extreme inflammation that's not resolving, or even chronic inflammation that's maybe not resolving, you might know somebody that will go to the orthopedic doctor or an orthopedic nurse practitioner to get a cortisone shot. Well, that is exactly like the cortisol that we produce, but now it's in a drug-like effect. And by all means, it definitely can help in so many situations. But what we got to look at is, well, even that is going to wear off. And if it doesn't resolve it, then what are we dealing with underneath? So that's why when I was talking about the four horsemen of the adrenal apocalypse, we have to talk about inflammation. So first can be the obvious, right? Like, we know it. And I do think there's a little bit of difference, because I don't want you to get worried about working out, right? If we work out, we might feel a little bit sore, but that soreness should get better and should resolve. It's not something that should linger or get worse. And if you're not recovering, within a couple days, then maybe you need to rethink what you're doing for a workout, because you might be overdoing it. But I think of like that more like, are you waking up every day kind of hurting? Are you, have you decided that your age is the reason, which is not really a good reason, right? But your age is the reason for the pain. Now, those are the obvious ones, but I also want to talk about what could be more subtle and could get missed. And as we know, with inflammation is an appropriate response in the immune system, right? It's part of getting sick. We have inflammation, we have inflammatory markers when we get sick. Cortisol should come in, should help us, manage this, bring our temperature back down, allow certain white blood cells to work properly. But what if it is more chronic? And this is something that a lot of times can be picked up on a complete blood count with a differential. And this is where we can see, well, sometimes the immune system is a little bit heightened. The white blood cell count is a little bit up, but maybe not like in an acute infection. And sometimes it could be normal to a little bit low. But then when we look at the percentages of the white blood cells, that can tell us a lot about if the body thinks it's still fighting something, such as if we have elevated neutrophils, low lymphocytes. That's one example. Another one we might see is elevated eosinophils and maybe even basophils, because they can elevate to produce more histamine as part of an inflammatory response. But when the eosinophils are elevated, that can indicate possibly a parasitic infection. It could indicate food or environmental allergies as well that could be going on. And I think that's one of the things I want to bring up is that what if this is kind of tying back into that gut? Uh, so many of us have gut issues, and we're taking the probiotic, or we're taking the antacid, we're taking all these different things, but never really resolving it. Or we find if we don't take XYZ, then we feel really bad. And what is that saying about what's going on in a chronic state? So I do think that chronic GI issues could point back to this inflammation. And also the thing about what happens when it's chronic, there's a point where you get a down regulation of the production of cortisol. So initially you might have lots of cortisol trying to put out this fire, and then there can be a down regulation. So basically cell receptors to cortisol can become a little more resistant. And I will see this. I'll see this in labs, normal, very normal cortisol, sometimes even feeling a little bit high, but does not equal someone who doesn't have obvious signs of inflammation. So there's something about that we need to look at. We also know, and I'll talk more about this one next time when we talk about the perception side of stress and mood. But also, if we have gut inflammation or GI inflammation, oftentimes that means that there is a degree of neuroinflammation. Many of you've probably heard the term leaky gut, leaky brain. And again, this is where it's kind of like everything's on fire and these different things, and we're mistaking what's happening on a cellular level. Oh, this is anxiety, or oh, this is now suddenly I can't think clearly. I have ADD, or whatever it is. But at the heart of it, at least a component of it could be this inflammation. And so with that, you might be going, okay, well, that's depressing. Not to talk about the next one, but it can feel a little bit overwhelming of going, all right, you start poking on yourself. You're like, oh, I can feel this, I can feel that. I do wake up every morning very stiff and so forth. So what is it that we need to do? I think ultimately a lot of this is going to come back to things that will balance our stress hormones. And many times cortisol is not the bad guy. Cortisol, as I've said again and again, you would die without. So it becomes a really critical, important part of our overall health and vitality, but it needs to be well regulated. And even in that, sometimes what ends up happening is we're not effectively moving between cortisol and cortisone. So there are some tests that will look at that, and you'll see maybe high levels of cortisone, but not enough cortisol. Even if you see that, the answer still kind of comes back to be the same, which is something that is tropho restorative for the adrenals, but regulates that pathway. And by nature, it's going to help with our sensitivity to cortisol, and ultimately looking at the balance of the rest of that steroid hormone family. In that, one of my favorite herbs is actually licorice, and it would be licorice that has glycyrrhetinic acids in it. Now, there's a lot we could get into, and I do think when you're going to get into herbs, it's really important to work with someone like me who is qualified and can guide you in the right path. So you're taking enough, not too much, but you're also getting high quality. But licorice is a natural regulator of that glycyrrhetinic acid pathway, this biphasic pathway that takes us between cortisol and cortisone. So if you're kind of stuck in cortisone, there might be something going on within the regulation of that enzyme pathway that licorice or the glycerotinic acids in it is a natural regulator of that. We also do see some benefit with the herb Romania, which incidentally also happens to be really good, for any kind of arthritis. I wouldn't say it was my top choice, but it certainly works well with some other herbs. So I think first and foremost, how we nourish the adrenals is certainly going to be important. And I'll just kind of keep bringing this up, so the more we do this, the better we all get at it, right? And then having herbs that are adaptogenic, which are herbs that are going to allow for the appropriate release of cortisol, if you will, and really keep that balance between cortisol and DHEA. That could look like ashwagandha, rhodiola, schizandra, and things like that. But one of the things that I wanted to talk about, and I think is probably a couple of my favorite herbs when we're looking at chronic inflammation, are these herbs such as boswellia, turmeric or curcumin. Celery seed has a lot of benefit. Ginger has a lot of benefit. We could look at things like grapeseed extract, things that also support the microcirculation, such as, ginkgo, gotu kola for wound healing, kind of in general. But kind of going back to the boswellia and the turmeric, these are two major players that not only help with inflammation, maybe thought of like for joint inflammation, but are also very good for inflammation throughout the body. So that could be neuroinflammation, GI inflammation, basically kind of anywhere that it exists. I think the challenge with those is certainly going to be quality and how well we can absorb them, basically so the liver doesn't break them down too fast and we don't get the full benefit. And some of that will go back to, we're seeing new formulas where the curcumin and the boswellia is paired with fenugreek. So it has this fiber sort of infused into it to allow it to stay in our system for more bioavailability and not just sort of getting flushed out by the liver. What's important about that is the longer we are on those, or spend some time on this, not only do they reduce the inflammation, they have a way to go in and basically turn off some of these chronic inflammatory markers. One of the big ones that's implicated in chronic inflammation, autoimmune, things like that, is nuclear factor kappa beta. And, once that one gets sort of stuck and gets triggered, then it can turn on like 400 other plus inflammatory markers. And you can take things like Tylenol and aspirin and so forth, and you're going to suppress it, but you're not actually going to turn it off. So you're not going to change the regulation of the prostaglandins, the cytokines, and different things like that. You're just basically getting, a little bit of relief, which I understand, sometimes we need the relief to help us, feel confident, I guess, in a way to go on and do the next thing. But there's been some really cool studies looking at even a trial with low back pain, where this one study in particular was done using NSAIDs. So that would be something like Tylenol with one group. And so when they do a study like this, they had, kind of like equal markers for the back pain or the pain that they were feeling. In the other group, they were using a combination of boswellia, turmeric, celery seed, and grapeseed extract. And what was interesting is that this study went on for 6 months. And this is like the most fascinating part. And kind of going through the two groups was looking at, the improvement along the way. As you would kind of imagine, the drugs, the NSAIDs, provided quicker relief, right? Like, the people in that study felt improvement more quickly. But I think what was fascinating is by the end of the study, the relief, both groups had equal relief, but it was, again, this was 6 months long. Now, where it really, really got interesting is that at the end of the 6 months, both groups were told to discontinue whatever it is they were taking. So if one group was on NSAIDs, the nonsteroidal anti-inflammatory drugs, that's what that stands for, they were told to stop. And the group that was on this combination of herbs that had boswellia and turmeric and so forth in it were also told to stop. And then they had them come back a month later. And that was when it got really, really good, because a month later, the group that had been on the NSAIDs reported that their pain was back. Okay. So it didn't, I mean, that's kind of where it's at. It didn't really last. The group that had been on the herbs are still reporting to be pain free. And I think what's so powerful about that is that when we take something, that's made in nature, that is working with us and on a cellular level and all these different ways, we're actually changing and turning around this chronic inflammatory response. Because inflammation for a trauma is really good. It kind of, you get fluid retention, you get some swelling of the joint. It's protective, and it kind of halts you from creating further injury. But when it's chronic, it's no longer your friend, and that's when it can actually really start to do some damage. Besides the fact that we start to have this, this chronic stimulus stressor to the adrenals to, hey, be like, got to do this, you got to do this, you got to put this fire out, you got to put this fire out. And when stressors become chronic without a break, this is when we start to get dysregulated. And that's why it's an important one to look at when we're talking about the four major stressors that can happen with the adrenals. The first one we talked about was sleep, right? And the second one we talked about was really in the digestion category, but in particular blood sugar as well. And then this next one is inflammation. What's kind of interesting, this one could be a sign of GI inflammation. That could be the source of chronic inflammation. If you are in pain everywhere, maybe you are not going to sleep as well. Or if you've got chronic inflammation, you're chronically surging cortisol, which is bringing your glucose up, which is antagonizing insulin. So it is really important to address the body as a whole and not just play whack-a-mole, not just like, well, I'll take a drug for this. Well, now you got 20 other problems. Well, now I'm going to try to take a drug for this and this and this. Whereas, when we look at the whole food support, nutritional support, food support for vitamin C, our healthy fats, good sources of minerals, all of that paired with our herbs, I mean, honestly, that's when we start to have, a better vitality, as I say, like we're starting to live this better life. But where, again, I'll say the challenge becomes is like, who do you trust? Where do you get it from? How do you know what is good? And this is why, as part of the idea of this podcast is to help you be a better detective about what's going on in your body. But I also hope that it leads you to the person who can help you. Now, that could be me, at Endocrine Wellness, or you might already have someone in your neighborhood or a practitioner that you're already kind of working with, that maybe you haven't told them these things. But this is all part of living a better life. Now, some of the other things besides what we can take, some people will get in and do Epsom salt baths. This could be a great way to pull, toxins, lactic acid out of the muscles. We can look at, some people will do the cold plunges followed with a sauna. We can also, and some of it is just about moving, just getting up, getting that joint mobility going in our ankles, our feet, our knees, our shoulders, not just becoming sedentary. And I say that as someone, who's almost 60, that this is very, very high on my list. We kind of take it for granted when we're in our, 20s, 30s, even 40s, that we're just going to be able to move. But it does change or become more difficult as for women as we go into menopause. But even for any of us that are not doing the right exercises, it's not just about being strong. It's about having that flexibility and that mobility that also leads into stability. And I really feel like that is tied into certain joint inflammation, because the joint is just not moving the way that it should. You're not getting the proper lubrication and fluid. So I do think that is another part of this that we want to make sure that we're always addressing. Okay, so that's about it. I want to keep it short. So that's like, this might be my shortest one on the adrenal apocalypse, if you will. But just to recap, we're talking about inflammation. And really, what I'm focusing on here is the chronic inflammation that could be associated with ongoing gut issues. We might have neuroinflammation where it shows up more looking like anxiety, depression, feeling overwhelmed. And then there's also the chronic inflammation that we know is associated with autoimmune disease that I would say is unresolved, because so much of the time, most people are given a drug to either change a number, like let's say in thyroid, well, you're given a drug to change the TSH, but you're not dealing with the underlying root cause with that. And that's why dealing with inflammation is so important. One, we can feel it. Sometimes it shows up in other ways. We also want to look at the things that are going to resolve it. So probably one of my favorites is going to be a good quality turmeric or curcumin. A second favorite of mine is one that is a combination of boswellia, turmeric, bupleurum, and gotu kola. I love gotu kola. But also keep in mind that reducing added sugar in your diet, making sure you're eating plenty of healthy fats. Eat more fiber. Fiber is going to stabilize your glucose. It's going to stabilize, help with digestion. It's very healing. And then if you are, taking some good quality supplements and herbs, it'll help with the absorption of that as well. So there's a lot of things that you can do on your own. And also just making sure the things we already talked about, getting enough sleep, balancing your digestion, get walking, get moving. If you need more help in those areas, then reach out, right? Don't try to chat GPT this, or Amazon it. Get help when you need it. And as always, you can always reach out to me at Endocrine Wellness as well. So I hope you found that helpful. And next month, I will be talking about our perception. So this really ties into the mood side of things and how our adrenals are responding to the very things that we think about. All right. Thank you all. You have a wonderful day, and I'll see you around the corner.